So hello and welcome everyone. Thank you for joining today's presentation from the Health Connector. It's just afternoon time, so we want to get started as scheduled. Again, we want to thank all of you for coming to today's presentation from the Health Connector, where we're going to be talking about our platform for small business owners and the plans that are available through our Health Connector for Business. So I'm Nikki from the Massachusetts Health Connector, and I'm joined today by my colleague, Melissa. Together, we'll be presenting our information and answering your questions. We'd like to take a moment before we get started with some logistical information to thank our partner organizations, including those in the legislature, as well as our broker community. So just a couple of things about our presentation format today. Everyone's audio has been muted and video has been turned off. The presentation portion itself will last about 30 minutes, then we'll have time for questions and answers. If you want to ask a question at any time, please use the Q&A button at the bottom of your screen. We'll be monitoring your questions throughout the session. And when you ask your questions, please remember not to share any personal information or private health information, as others on the webinar may be able to see what you write. Now, we are recording today's webinar, and following our session, you'll receive an email with this presentation and a link to the video recording. So there's no need to take detailed notes. So we're just afternoon time, so let's get started. Again, thank you everyone, and I'll hand this over to my colleague, Melissa, to get us started.
Thank you, Nikki. And yes, welcome everyone. Again, today's webinar is titled Health Connector for Business, Affordable, Flexible Health Coverage. So whether you are, this is your introduction to the Health Connector for Business platform, or you're already familiar with our services, hopefully you'll get some good information today for yourself and your groups. So just as an overview of what we're going to be going over today, obviously we're going to touch on who the Health Connector for Business is, how to get started, some of the unique benefits that groups receive going through the platform. We'll go over also options for sole proprietors and owner-only groups at the very end. So what is the Health Connector? So we are the state's health insurance marketplace. So we do offer coverage for both individuals, families, and small employer groups. So on the small business platform, a business can offer coverage to their employees while going through the state. So people who are not offered health insurance through their job or other sources may also be eligible for individual coverage. And there's a lot of help for those who may qualify for help paying with the American Rescue Plan. So a lot of options for both the individual and small business enrolling through the Health Connector. So the Health Connector plans, whether you're enrolling as an individual or through a group, you can rest assured that they meet all of the state and federal standards for coverage. So we have qualified health and dental plans. We do have some catastrophic plans, health plans with advanced premium tax credits. So that's people with incomes in a certain range may qualify for more tax credits, which would reduce the cost of monthly premiums. Connector care plans available for those in lower income ranges and meet other eligibility requirements as well. And again, the Health Connector for Business, eligible for any small groups with less than 50 full-time employees. So some of the health carriers that are available on the Health Connector platform, you'll see a list of them here. We have Mass General Brigham, Blue Cross Blue Shield of Massachusetts, Harvard Pilgrim Health Plan, WellSense. We have our dental carriers, Delta and Altus. So a number of carriers here available on both the individual and small business sides of the platform. Okay, so that's kind of an overview of the Health Connector. We're going to go a little deeper into the business side. So to be eligible as a small business on the Health Connector platform, you must meet a few requirements. One being that you, for employment, it's one to 50 full-time eligible employees. So this is a rule for initial onboarding. So we do have some groups that end up growing past, they'll end up adding more than 50 full-time employees, say a year in, but at when they initially come onto the platform, you cannot have more than that. You have to have at least one non-owner enrolled. So at least one full-time eligible employee who is not an owner, and the business must be based in Massachusetts. Your employees can live outside of the state, but the business has to be based here. Some additional requirements that you'll see down below in order to become active. So a group can, publish a benefit package, select health benefits, but in order for it to go through for the group, there is a participation requirement. So the group must have at least 75% of employees participate. Now that does include waivers. So if you have employees who will not be electing coverage, they're choosing not to enroll will count as a participation. So we just have to make sure that they act one way or the other in order for the coverage to go through for the whole group. So on this screen, you're going to see some of the benefits for groups who enroll through the Health Connector for Business. So full carrier participation, again, this is the only place where a small group employer can access all of the leading carriers in one spot and do that sort of comparison to see what's going to work best for their employees. Competitive premiums. So small businesses, they do save on average 20% before any rebates. On those rebates, we do have the ConnectWell, which is our wellness program. We're going to get into that a little bit more later, but employers may be eligible for an additional 15% rebate at the end of the plan year. So that's going to be a savings on what they've contributed over the course of the year on the employees' premiums. Flexibility, that you will see with the way that we are able to offer coverage or the way that employers are able to offer coverage through our platform with the employee choice models, which we will touch into here shortly. Assistance through certified brokers. We have over 500 currently certified on our platform available to help small businesses with their plan options. And again, that peace of mind, just knowing that anything that you decide to go with on our platform is going to meet those requirements, those minimum requirements for at the state and federal level. So again, part of that coverage, those requirements, you'll see a list of things here that are going to be included with any of the plans that you select, right? This is that minimum coverage standards, which will always include things like maternity and newborn care, office visits, pediatric care. Additional plan benefits, of course, can be found on our website, but this is kind of an overview of the minimum of what you can expect. So a few other just quick highlights on the Health Connector for Business plans. Obviously, we do have health savings account plans, HSA plans available. So they are there, the HSA eligible plans. Out of state coverage, if you have those employees who reside out of state, we do have, nowadays a lot of employees who work remotely, they will have access to PPO plans on our platforms, which do utilize a national network. And new to 2025, there are now PVP flags when you are shopping, part of that experience that will basically allow you to easily identify lower than market average premiums when you are searching for and comparing plans. Okay, so how to get started if you are a new group, or perhaps you're a broker that is working with a new group. We do enrollment every month for new groups. So our deadlines are going to be the same every month, and as is the process. So of course, you'll want to visit our website, check out all of these unique benefits, create an account as an employer, which again, all of this is done online. So the deadline to select a benefit package for your employees will always be on the 10th of the month. This will allow your employees time to shop. So you've selected the plan, enrollment opens. We give your employees until the 20th of every month to complete their shopping. The 23rd is when the group's initial binder payment will be due, and that's for that first month of coverage. And then, of course, your coverage will begin on the first of the month. So again, these deadlines are the same each month on the small group platform. We always are going to encourage our employers to consider using a broker when they're shopping for a health package for their employees. Again, we have over 500 that are currently certified on the platform, and they are a tremendous resource for employers. There's no cost for the employer to utilize a broker's services. That's something that we provide as assistance for the employer. Brokers are very familiar with the plans on our platform, so they, again, the choice models, they are familiar with how they work. They can provide quotes for you so that you're able to get an idea of, what's going to work best for your employees, and you'll know exactly what it's going to cost you. Again, they understand the plan options, and ultimately this boils down to a huge time saving for the employer, right? Small business employers are busy, so using a broker will save you a lot of time getting everything set up. And not only that, but throughout the course of the plan year as well, when it comes time for renewal or everything in between, if you have employees, new hires that need to be added, or anything, qualifying life events, they are there to assist you for that. So again, highly recommend using a broker. So the employee choice models we touched on as a unique benefit of the Connector platform. Again, we have 3 different ways or benefit models that an employer can utilize when offering coverage to their employees, whichever one works for them, but they have these 3 options. The choice models are designed on the employer side to control costs, while also giving the employees multiple choices based on their unique needs. So the one plan is the one that we'll touch on first really quick. A lot of your employers, or you as an employer, are going to be familiar with how this works. It's basically where the employer would select one plan. So one plan from one carrier. It's a very take it or leave it sort of approach. And that is the only plan that your employees would be able to select. If you do this, the rates are established when enrollment closes. It'll calculate a group rate based on all of the employees who enrolled, right? So that's what we refer to as composite billing methods. So you'll have a set rate for anyone enrolling as employee only, anyone enrolling as employee plus spouse, so on and so forth. And those rates will remain locked in for the entire group for the whole year. This is a very simple, a lot of employers like this just because, again, it's simple. And if you have a group also that is interested in a bronze plan, you would want to go with this one plan option because it is only offered at the one plan level. So one carrier works differently. This is unique to the Health Connector. In this scenario, the employer selects one of the carriers that we have available on the platform. So for example, let's say they went with Blue Cross. From Blue Cross, the employer will select one plan that they are going to contribute towards. So they can choose, for example, a low silver Blue Cross plan. The employees, however, would be able to select any of the Blue Cross plans available to them. So they can shop across tiers. If you have one employee that wants to stay on the silver level, they can do that. But if you have others that are, need gold or platinum, they can do that. So this is a great option if you have employees with different needs, some that maybe go a lot to the doctor and they need a lower deductible perhaps, and then others who, don't mind a higher deductible and less out of their pocket every month. It suits them at all levels. If you have an employee that does need to utilize a PPO option, so that's that out of that nationwide network, they are available at the one carrier level. You'll just want to make sure that you select a carrier that offers a PPO. The billing here works a little differently. So each employee will have a different rate based on their age. So we refer to this as list billing method. Again, so your younger employees, your older employees, they're all going to have a different rate. Now the employer, though, their contributions are going to be fixed on the one reference plan that they choose. The one level works exactly the same. The only difference here is instead of selecting one carrier, the employer would choose between a tier, gold or silver. From within that tier, they would select one reference plan. Again, this is the one plan that the employer is going to contribute to, but the employees would be able to select any silver or gold plan across multiple carriers. So if you've got one employee that needs Blue Cross, another one needs Tufts Direct, they can shop based on their network needs. And again, the employer is only contributing towards the one plan that they choose. If the employee selects a plan that's more expensive, they would pay the difference out of their pocket. Okay, so that, and I think I forgot to mention that on the one carrier option, it's the same. One level and one carrier, employer cost stays fixed. The employees can shop up or down, but if they decide to, shop above and it costs more, that the employee would pay that. It's the employee's responsibility. PPO options are also available at the one level benefit model at the silver tier. So, and of course, if you have any questions about this, always reach out to our team. Okay, so the ConnectWell program, that is our wellness program we briefly touched on a little bit earlier. So all businesses qualify for ConnectWell when they enroll through the Connector platform if they have 25 or fewer enrolled employees. So in order to participate over the entire course of the plan year, employees would just need to participate in or submit one qualifying activity over the course of the year. If they do this, then the employers would be eligible to receive a 15% rebate on what they've contributed towards the employees' premiums over the course of the whole year. So that's a huge savings. Again, only a percentage of the enrolled employees need to participate. And again, it's one activity required for the whole plan year. And if they do submit that activity and it's approved, then the employee, as their incentive, they receive a $100 Visa gift card. Now, for those activities, there's a wide range of approved activities. A lot of these are going to be activities that your employees participate in anyways throughout the course of the plan year. So mind, body, money, those are the categories. Things like, if they go to the gym, they have that gym membership, going to your annual checkup with a doctor, financial planning courses. There's a really long list of things that qualify. So those links will be provided and you can check them out. But again, highly encourage your employees to submit these activities. This here is an overview on the timeline and the ConnectWell process of basically how it's all done. So again, when the group comes on to the platform and they publish a benefit package, they're basically automatically enrolled. They will receive notification by email within 10 days of the plan start. Your employees are going to be sent emails with the incentives and instructions for how to participate. Your employees, the submission form is completely online, so they would just submit their activity for approval. The approvals received online. Any follow-up questions that there might be would also be submitted online. So basically, that's all the communication is going to be in the same place. Once approved, the employee is going to receive that $100 gift card. The group will be notified as to where they are at towards reaching the participation at the end of the plan year. And that's again for that rebate. So, and the employer can also reach out at any point and say, hey, are we eligible? Where are we at? But once we've confirmed that the group is eligible for the rebate, then at the end of the year, you receive that 15%. So, and again, throughout the whole year, you will be sent reminders, so on and so forth. And you can always ask us questions. The small business healthcare tax credit, this is a federal benefit that we like to encourage our employers to find out if they qualify for. One of the requirements to be eligible for this is that you enroll through the state marketplace. So the Connector, we are that. So any group that enrolls through the Health Connector for Business platform has already automatically met that one eligibility criteria. So the other ones are going to be listed here or on the IRS website. So we encourage you to check into that. And again, find out if the other requirements are met, because if that's an opportunity for additional savings, 100% you'll want to look into that. So on this next part of the presentation, we're just going to kind of touch on what employers are experiencing with the Health Connector for Business. So here you're going to see a comparison for shopping. So this is for on the on the small employer side and their employees. So you'll see here, again, we mentioned earlier, on average, over 20% a small business saves by offering coverage to their employees through the Health Connector for Business. And this is, again, before any rebates are applied. So you're going to see here across different tiers, the typical savings that an employer experiences just by going through our platform. Time and time again, we have the majority of our groups just continue to renew, and these are going to be the main reasons, right? The employers enjoy the flexible choice models that we offer, which just again allows them to control cost on their end while still having those different options for their employees. All of the rebates available to help them save on their costs throughout the course of the year, of course, the potential tax credits, and no fees. There are no fees for groups to enroll through the Health Connector for Business platform. So all right, so we have again gone over those benefits for small groups, and we'll be happy to answer any questions that you have at the end. But for now, I'm going to let Nikki talk about options for those who are enrolling as sole proprietors or owner-only groups.
Thanks so much, Melissa. So as Melissa mentioned, I think you want to go back one slide. There you go. As Melissa mentioned, we have options for those who are sole proprietors or are owner-onlys. As they can't buy health insurance coverage through Health Connector for Business, we do encourage people to take a look at our options on mahealthconnector.org, the site for individuals and families looking for coverage. So there are lots of opportunities for savings available on mahealthconnector.org. And there are specifically two types of help that is available. And that's advanced premium tax credits as well as participation in our Connector Care program. So because we're a state-based marketplace, we're the only place somebody can access advanced premium tax credits. So what that does is these are federal dollars that lower the premium amount somebody will pay each month. And the IRS is going to send that tax credit directly to the insurance company that you enroll in. So as a consumer, you simply just pay less each month. Now, when you are receiving an estimate of your advanced premium tax credit, you might consider taking some of that or taking all of that tax credit. So you have a choice. You can apply some of that or all of it to your monthly premium payment so that you can see that reduction, that complete reduction of payment in your monthly premium. Now, exclusive to Massachusetts, we have what's known as the Connector Care program. And this program uses federal advanced premium tax credits plus state dollars. And those two together help reduce the premium amount somebody will pay each month. So through the Connector Care program, someone is going to experience lower monthly premiums, low out-of-pocket costs, and no deductibles. So just to give you a frame of reference, depending on the plan type somebody qualifies for, they could see a plan as low as $0 a month or $260 a month. And you'll be able to, I'll show you some resources on the Health Connector website so that you're able to see if in fact you could be eligible for savings and what that could look like. Going on to the next slide. I want to just talk a little bit about open and closed enrollment. So right now, the Health Connector happens to be in an open enrollment period. So that's basically the time of year when individuals and families can apply for new coverage for the coming year or renew coverage or shop for a plan. So the Health Connector's open enrollment began on November 1st, and it actually runs through January 23rd. And that is for coverage that's effective January 1. Now that we're in January, if you were seeking to apply for the first time and enroll in coverage, that coverage would start on February 1. So just know that any Health Connector plan, whether you are purchasing it through Health Connector for Business or on the individual and family side, everything always begins. The coverage plans always start on the first day of the month. Now, if you need coverage outside of open enrollment, please not to worry. We just direct people or recommend that people apply and see if you qualify for some type of special enrollment period. So depending on your circumstances, you might find out that you qualify for Mass Health, which has different start dates, different rules. And if you want to look at all the different types of qualifying life events, we do have that available on our website. Now, you might be wondering, what do you need to apply? Or exactly who should be applying? Who's eligible to apply? So first, you need to be a Massachusetts resident. You need to be a U.S. citizen, U.S. national, or considered lawfully present in the U.S. And you need to be somebody who doesn't have access to health insurance. So you shouldn't apply if you are already enrolled in Medicare, Mass Health, the Mass Health program, which is our Medicaid program, or any other public health coverage. So an example of that would be our veterans coverage. Some veterans coverage is really comprehensive. So if you have an offer of affordable comprehensive health insurance, from an employer or a spouse or partner's employer, or if you're incarcerated, you should not be applying as you have access to other type of health coverage. On to the next slide. I started to mention what you would need to apply. So these are the important documents you'd want to gather for everyone who's applying. So you want to get together social security numbers. If anyone in your household has immigration documents, you want to gather those as well. Recent pay information. So when you're applying on the individual and family side, if you are applying for help paying for your coverage, we're going to ask some questions about income. So that's why we're asking about, last two pay stubs. If let's say you're unemployed and you've decided you want to start your own business, great, that's fine. We just need to know about that monetary determination. That's the amount unemployment is providing you. If you are self-employed, we just need to know about your net income. And if you didn't file taxes last year or your income has changed since the last year, just information about currently what your income situation looks like. Now, we tell people all the time, if you don't have all the information that's listed above, submit the information you have. And when you get to the end of the application, we're going to tell you what other information we need. And we'll also send letters asking for more information if we need it. So I know income is a very big topic for folks. So we have, as Melissa, no, actually, I said, or Melissa said at the beginning of the session, pardon me, you'll be getting these slides, you'll be getting all these links. And so again, you'll be able to go to our website and easily navigate to find this information. So on to the next slide. You might be wondering, okay, or thinking this is a lot of information. Is there free help on this side as well? So Melissa mentioned, if you have employees, you want to consider talking with the broker, seeing if they, could be of assistance to you. Remember, that is free assistance. On the individual and family side, there also is free enrollment assistance available across Massachusetts. So that's available through customer service. And our customer service on the individual and family side is 877-623-6765. Help is also available through community partners. Now, these are people who have been trained and certified to help answer questions about enrolling into health insurance coverage through the Health Connector, but also, they can help you throughout the year. So if you go to the Health Connector's website, you can find a list of free help that's available. You can just type in your zip code and you'll be able to locate a navigator or another certified assister who can help you. On to the next slide. There are just a couple of shopping and enrollment reminders. And Melissa, I would love to pass it back to you to go through this because some of these deadlines are actually the same for both platforms. But then I know that there's different steps that you want to remind people to go through on Health Connector for Business.
Currently. Yep. So again, small business employees and owners that do not offer to qualified coverage on the business platform. So your sole proprietor groups and individuals, you'll want to apply, enroll, and pay their first premium by the 23rd of the month prior to coverage starting. So for example, if you are looking for a 1/1 January 1st enrollment date, you would need to enroll and pay by the 23rd for that coverage to begin on the 1st. You can also choose to have your coverage start on the second month after you enroll. Okay, and that's on the sole proprietor on the individual platform. On the small business platform, again, because we have enrollment every month for new groups, we do follow the same deadline. So that 23rd payment deadline is the same on the small business side. So you'll need to make the initial binder payment for your group on the 23rd in order for coverage to begin on the 1st of the following month. But in addition to that, we have the previous deadlines to publish a benefit package. So that's the date that the employer will need to select what you're going to offer your employees and open enrollment for them. The 20th of the month is the shopping deadline for the employees. So by the 20th is when they will need to either enroll or waive. And then again, that 23rd initial payment deadline every month. And coverage will always begin on the 1st of the month. Go down here. Okay. So questions, if anyone has any questions, we would be happy to answer those for you now. And again, you will get all of this information sent to you, but please feel free to ask any questions that you have. Let's take a look. It looks like we already have some. Let's see.
And Melissa, would you like me to read some out to you? Would that be okay?
Sure. Go ahead.
Sure, no problem. So one of the attendees asked, what does PVP stand for? So PVP plans. So the new designation of the plans that was listed, I believe it was listed on one of the slides. I'm sorry, I can't. I know you're pulling. Are you pulling the slides back up?
I am.
I think they're
Yeah.
talking about the value plan designation. So when the brand new designation, I think that they're not necessarily new plans that the Health Connector is offering, but rather the Health Connector for Business is actually highlighting specific plans to say like, hey, this is
This is the ones.
this is a plan that is of that like this price point, and these benefits are of value.
Thank you, Nikki.
No, no worries, no worries. Okay, here's another. Do part-time employees count as an employee?
They do, but it depends. So for on the small group side, only full-time eligible employees need to be offered coverage, but an employer can also coverage to part-time employees. However, if they offer coverage to a part-time employee, they have to offer it to all employees. And there are calculators that we use and that the employer can utilize to determine, if a number of part-time employees would equal one full-time employee. So if you have specific questions about that, definitely let us know and we can send you the calculator and work with you to determine, those numbers. So yes, they can, but don't have to.
That's great. And then this question, I'm not sure if this question is for the individual and family side or if it's for Health Connector for Business. But they asked, what information is required to have on hand during the application process? So could you answer it from a business perspective first?
Yes. So again, everything is going to be submitted online. So there's no actual like documents in hand, but you are going to have to submit on the business side to prove eligibility your most recent payroll as a PDF or quarterly wage report. And again, we use that just to determine group size eligibility so that you don't have more than 50 full-time employees on the payroll. And then of course, for quoting purposes and rates, because on the business side, it is employee age that will determine that. We're going to need employee information, right? So their dates of birth, so on and so forth. But those are the only sort of things that I can think of offhand that you would need during that application process.
Okay, great. And so on the individual and family side, I kind of went through the checklist fairly quickly, but you'd want any income information that if you're applying for help paying for your coverage, you want to have income information. You also want to have, are you pulling it up, Melissa? Are you pulling up that side? That would be lovely
Pulling
if
up
you
the
do.
presentation again. Sorry, everybody.
No, that's fantastic. So, essentially it's income information, it's social security numbers. If someone has a different immigration status, we want to be able to have, you'd want to be able to have that information so that you can, include that into the application. All right, so here's a super easy one. Will we be sent the recording? And the answer to that is yes. Yes, we will. All right. Melissa, hoping you can answer this one. This looks like somebody is interested in becoming an insurance broker. They have a they have a health license. So I don't know if you want to guide them because we don't certify somebody as an insurance broker. So I don't know where you would want to direct them to.
Right. So, yep, you would do that on our site. If you go to mahealthconnector.org, you're going to see a section that says brokers, and there will be a link there for you to apply to become a certified broker. It's really simple. So you've already got your license. You're going to provide that, your NPN number. You just submit the application, which I then would receive. And then you'll hear from me. I'll end up reaching out to you and providing you with those next steps. But it's a very simple online quick application. And then you and I would set up a time to do a certification training, which we would go over how to use the broker portal, the ins and outs of assisting groups as a broker on the platform. But that's the first step. So just mahealthconnector.org, find where it says brokers, and you'll see where to submit the application.
Thank you so much, Melissa, because I'm so sorry, I misread the question and I thought they were asking how to become an insurance broker, but they said, how can I become your insurance broker? So that's fantastic. Thank you so much for your interest. Okay, next question. What if you're a sole proprietor, but the business had a loss or zero income in 2024? So on that side, essentially, you would need to basically provide proof of the zero income. So there are a number of ways that you can do that. If you're submitting quarterly wages, wage information or quarterly tax information, you could submit those documents. And if there's also an affidavit that you could submit to say that you had zero income in 2024. But essentially, when you are applying for help, help paying for your coverage, there's a data check that is done. So if there was a significant change in your income from last year to this year, there'll be a flag that's kind of goes off in the background. So you will need to provide proof of, why that income had shifted so much. All right, great. Now, all right, I have another one for you, Melissa. It was mentioned that Health Connector for Business is available for groups from 1 to 50 people, but that if only one person enrolls, it can't be the owner. We have a small business of 5 people, but wanting to understand whether an employee would need to enroll in order for the owner to also enroll. So you might want to just go over that a little bit.
So correct. So if you can have only one person enroll, but it cannot be the owner. So if you have those 5 people employed with your small business, at least one that is not considered an owner would have to enroll for the whole group to be eligible. So the owners can enroll, but one other has to enroll besides them. So if it's owner, the other person can't be your spouse enrolling. They are by extension considered an owner. So yes, to answer that, at least one non-owner needs to enroll. And I can actually see the questions
can
now.
you see them now? Okay, great. Fantastic. Great.
So is the Health Connector for both for-profit and nonprofits? Yes, on the business side, we do enroll nonprofit groups as well as for-profit groups. Again, the business though, whichever you fall under, has to be based in Massachusetts. After you publish a plan for a renewing group, is it possible to change to another option? The group has the single plan option, but they'd like to see if other carriers would be better for the employees. Okay, so of course, there's going to be their renewal period, so they would be able to make that change for their upcoming renewal. But if a group is interested in making a change outside of their renewal period, then they would have to submit an off-cycle request. So they can submit that. We would just advise them that the plan year would reset for the entire group. So say your plan year runs from January 1 to January 1, and the group wants to make a change in May. Their plan year would start over in May. So that means if you have any employees who might have already met a deductible, for example, that would reset for them too. But it is an option for them. Now, if you have any questions about that, if you have some kind of unique circumstances, or maybe the group offers an option and you just have an employee that needs to make a change, just reach out to our team so that we can kind of take a look at your group. But very good question. Okay, regarding business requirements, if we employ about 12 people, 4 to 5 full-time, but also minors who would decline, are we eligible for small business plans if we offer insurance, but all employees decline, except owner, family members who are also W-2 employees? Okay, so in that scenario, you would not be eligible because you have to have, again, at least one person enrolled that is not considered an owner or family member of an owner, even if they are W-2 employees. So you would just need one more, but that one person is necessary. On the business side, do you need Social Security and pay for employees in order to get a quote to evaluate whether you will offer insurance to employees? So no, the answer to that is no, and that's a very good question. So when you will need Social Security numbers to when you actually open enrollment, because the carriers are going to need that to reflect their actual enrollment. But just for quoting purposes, no. What you will need is the date of birth, and that's just to ensure that the rates are accurate. Pay information is never going to be necessary because it's not a factor in the rates on the business side. So again, the big thing that you're going to need is the date of birth for the employee. And that's it really for quoting. It's a good question. I have a new business, an S Corp. I incorporated in April, so I've been in business longer than 6 months. I'm the only employee, and my owner only. I don't have tax forms yet to verify business income. Does this mean I can't be eligible, and I need to wait until the first tax season is completed? Also, I will hire my first employee this year, but they are a family member. Does this mean they don't count in this scenario? I have an individual Health Connector plan currently, but was hoping to get it through the business in the future, so the premiums might be a business expense instead of a personal one. So this is something that obviously a lot of business owners sort of in the same situation. So with the tax forms, always reach out to us, our verification team, because for new businesses especially who may not have the documents that we've requested yet, there are alternate or different things that we can accept. So just depends on kind of your business and where you're at. So just reach out to us and we can work with you as far as which documents we can accept. But it will still apply if you are the only employee, that you would be considered owner only. That would still be the case. And if you do have an individual, or excuse me, you do hire your first employee, but they are like an immediate family member, again, you would still be considered owner only. However, again, because we do enrollment every month, if that changes, say the following month you have an additional new hire who is not a family member who would be enrolling, you can jump over, you can keep your individual plan and then jump over and enroll as a business, whichever month you need to. So you would have that option later on if that changes. I hope that answered that.
You did, and I guess I just want to encourage this person that if they do need health insurance coverage, to simply apply on the individual side. They do not have to wait for all those tax forms to be processed, etc. So in the immediate, or actually it sounds like they're already on the individual side. So never mind. In the immediate, not to worry.
Thanks. Does the 10th of the month deadline for account creation also apply to sole proprietors?
No, it does not.
How long does it take for participants to receive their insurance cards? Great question. So on the group side, we always advise employers to allow 7 to 10 business days from the first of the month. Now, if you have employees that are enrolled, the carriers will reflect you in their system. So on the first of the month, you should be able to obtain services, outreach the carrier and confirm enrollment. But the actual physical cards, you'll always want to give it 7 to 10 business days from the first of the month to expect those in the mail. Where do I find a broker? I might have missed it. Nope. So there are two places that a small business owner can locate a broker on the Connectors platform. If you have created an employer account already, you can do it directly from your employer account. We have a directory there, and that is where you will end up selecting a broker to work with your group. Once you do that, they will receive notification and they'll have access to that employer account so that they can assist you directly. So that's one place. If you have not created an employer account yet, you're just sort of looking on our external site, mahealthconnector.org. If you go to the employers business section, it's pretty in your face. It'll say find a broker. It's basically our broker directory is there for you as well. So maybe you just want to submit your zip code and see who's sort of in your area. That's kind of a good way to start. Or if you have someone in particular you want to search for, you can find them there as well. How do I get a copy of all showed slides? We will email those to you. So as an attendee. Can we work on brokers getting better access to the ConnectWell program? So that's a very good question. So the ConnectWell, of course, it's done internally. These submissions, everything's done online, but we are in discussions right now for the ConnectWell program. Any kind of updates as far as the accessibility to things like the submissions, the status of participation and the rebates. If there's any changes that are to be made there, we're going to communicate them to the broker community as soon as possible. But we're always talking about these things. So any suggestions you have, send them my way. I am a real estate investor. I have no employees, currently have health insurance from my spouse. I would like to get our family a new insurance under me, including my wife. How do I go about it?
So definitely come to the individual and family side. You can search for a plan for your whole family. So certainly take a look. mahealthconnector.org.
Do employers need to have an SIC code to qualify for Health Connector for Business? It's not an eligibility requirement, but it is something that we will ask you for when you are creating your employer account. So if you have any questions or issues with the SIC code, definitely please reach out and I can assist you with that. Does that part-time have to take insurance through you or for you just to have a part-time? So for on the business side, part-time employees, you do not have to offer coverage to part-time employees, and anyone who's offered coverage does not have to accept it. They will always have the option to waive coverage. You just need to have one full-time employee enrolled in order for the group to be eligible. I'm not sure if that was the question. If I didn't answer that right, just let me know, and I'd be happy to shoot you an email or answer any other questions you might have. Employee who works in Massachusetts and lives in New Hampshire can get coverage. Yes, absolutely. Again, on the business side, as I'm again speaking to the business side of the platform, employees can reside outside of Massachusetts. If they want to access care outside of Massachusetts, they may want to enroll into a PPO that gives them a national network. But as long as that business is based in Massachusetts, yes. How about if none owner employee left the company in the middle of the year? Oh, that's a really good question. So that's fine. So if you are a small group and at the time that you enroll, you've got 2 or 3 full-time non-owner employees enrolled, those employees leave for whatever reason at the course of the year, to leaving the employer as the only enrolled group, you're fine. You're not going to get kicked off the platform or lose your coverage. However, at renewal, just you may hear from us. You may just for some verification questions or to make sure, but no, you would be able to stay on should that happen to you. So, which documents are needed to prove sole proprietorship, DBA, business bank account, etc.?
None needed. None needed. You're simply applying for health insurance coverage on your own.
Okay. Is it possible to meet with a broker in person? It is. I know several of the brokers do in-person meetings with their groups. It just really depends. There are, kind of like everywhere, some brokers are mostly doing all remote work, but I would just recommend, talking about that with your broker and setting something up. But yes. Clarification of my prior question, under employer eligibility, point number 2, has at least one non-owner employee. What if that other employee does not want to enroll? Can the business still enroll and offer insurance that the owner family members can purchase? Again, that at least one has to be enrolled. So the one non-owner, they can choose not to enroll, but in that case, if it's only the owners that would be enrolling, they would want to utilize the individual platform until such time as a full-time employee would need to enroll. That's not a family member. But good question. So again, can that one person be a family member? No, not on the business side. And then, of course, any questions that are a little more specific regarding, I can send kind of the eligibility. It's all on our policies website or section of our website on the small business side as a resource. And I would be happy to look into those questions a little deeper for, individual or cases. But yes, basically anyone considered a family member, an immediate family member, would be an owner. So no matter the kind of group. Employee who works in Massachusetts and lives in New Hampshire can get coverage. Yes, correct. Have I missed anything? So, okay, let me see. Oh. Can you develop a guide for the ConnectWell program for employers outlining in detail deadlines and courses of actions? Yep, I have something I can send to you. So, Brett, I will shoot you an email after this. If anyone has any other kind of unique requests, please feel free to send them to me directly, and I'd be happy to send you what we have. If my company wants to enroll during this open enrollment period, does that mean I need to get a quote and decide, and open a portal by Friday? So on the business side, if you are looking for coverage to begin on February 1st, those are the deadlines, but please reach out to me directly so that I can assist you. Again, if you need coverage by a certain date, always reach out and ask, even if you're afraid that maybe you won't meet this deadline, because we always want everyone to be covered. So just please reach out. Sorry, I missed this section for sole proprietors. What are the core requirements for me to be able to sign up for myself and my family without any employees?
Sure, absolutely. So you need to be a Massachusetts resident. You need to not have access to any other type of affordable comprehensive coverage. And you need to be a U.S. citizen or considered lawfully present.
This is a really good question. If a person has a plan from the individual marketplace and then enrolls in small business group plan, how does the individual plan cancel? This is great. The employee will need to contact to have their individual plan canceled. It won't automatically, our systems don't speak to each other in that way, if that makes sense. So definitely have the individual plan canceled the last day of the month before the small group plan starts. And that's just to avoid any kind of issues with the carrier. Is the rating based on all eligible employees or only those that will be enrolling? We have 3 employees, but only 1 currently requires health coverage. Should we submit all employee info? Another great question. All of the employees will need to be added to the roster, and they might be included in the estimate that the employer sees, but no, actual rates are always going to be based only on who is enrolled at the end of open enrollment. So the final rates should be based only on that one enrolled employee and not the others. How do you waive employees not enrolling but on census without them logging on and waiving themselves? Very good question. We're always going to encourage them to do it themselves. It's a very simple process. It's quick. They could just create their account online and waive. Again, if you need assistance with this, though, please reach out to me so that I can assist.
And Melissa, if I could just pause, there is a question down at the bottom where folks have said, how do they reach you? So I don't know if I don't think chat has been enabled. So I don't know if you want to give them
Let me
your email.
send my email. Yeah, 2 seconds here.
Okay, great.
I'm the worst at this, but I'm gonna put my email address in the chat so that you can shoot me an email.
I
Great.
don't know if chat is enabled, but
Oh, okay.
we can also include it in the follow-up email.
Yes, that's perfect. That would be so perfect. Yes.
Okay, great.
You okay. Let's see if we've got any more here that we have time really quick. Uh, What is the general range of employers' cost for insurance per employee? Good question, because I wouldn't say there is a general range. It's going to depend on the size of your group, the age of the employees of your group, which carrier you go with. So that's kind of the great thing about the connector platform is it's going to be very unique for your group. So obviously, I'm going to recommend that we just look at the quotes. So, just reach out to a broker. Of course, you don't have to do that. You can do it on your own, but I would just recommend getting onto the site and taking a look at what it looks like for your group.
And Melissa, would it be okay if I answered the Cobra question, if you don't mind?
Yes, yes.
So someone's asking, they're saying that they were laid off and their company's offering to pay for Cobra for 3 months. However, they want to see if there's a more appropriate plan and if they, can they just take the Cobra for now? And then if they find a different connector plan that's better, can they just cancel the Cobra? And the answer in that situation is yes. That is, if the company is actually subsidizing your Cobra coverage and then the subsidies end, you would be fine to cancel your Cobra, and then you would be you'd have a special enrollment period. You would essentially say you lost access to affordable coverage because the Cobra coverage is no longer subsidized. So certainly do that, but prior to enrolling, I mean, you can start shopping now. Prior to taking the Cobra, you could certainly start shopping now. If you go to mahealthconnector.org, in the upper left-hand corner, there's a get an estimate tool. And I think this is important and helpful for everyone. When you're looking for an estimate, you would either select an estimate for business or an estimate for individuals and families, and then you're going to be guided. So definitely we encourage all of you to look at those estimates. Estimates are not commitments. So definitely look and see if these are something that you are interested in enrolling in.
I love that. And yeah, just again, we have one more question about the clarification on eligibility and family members. Again, so just to touch on it, there isn't a single non-family member. Is it necessary really to have a non-family member? Yep. So on the business side, family members will be considered owners. So you are going to need that one non-family member to enroll at initial enrollment. But again, please reach out. I'll say that again. If you have any questions about your group's eligibility that isn't clear to you from the links or something else that we've provided, please feel free to ask. Well, look.
Yep. I just wanted to encourage everyone to keep an eye out for the email that Melissa and Delia were referencing. It will include all of the slides. It will include a link to the recording, and it will now also include Melissa's email address. So Melissa, I will let you thank everyone and say goodbye. We had such an active group today. Thank you. Thank you, everyone, from my perspective.
Yes, thank you so much for attending. I look forward to speaking to you all again soon.